The program today is an amazing program. They have a paid staff of 6 people. They continue to do the needle exchange work, including information about safe injection and all the related supplies you need, like alcohol pads to wipe clean the spot before you put the needle in.
We have a wound care consultation clinic, but we're going to be doing that on a mobile basis. We've got a van that we were able to purchase, statewide naloxone mailing project. We've also started distributing fentanyl test strips, which has been another tool for people in trying to reduce overdose deaths, to have a somewhat better understanding of what's in the drugs that they're taking.
The overdose prevention work continues, connecting people to any other social services that they might need. So it's become more of a full-service program to try to help injection drug users deal with whatever problems they're facing.
Prevention Point has been exceptionally thoughtful, mindful of making their services as low barrier as possible.
You are non-judgmental. There are some programs that make you kind of listen to an appeal to get into treatment, things like that.
It's had a really profound effect on a generation of healthcare and social service providers in terms of how you can do work, not just by thinking outside the box about how you do the work, but actually building a bigger box.
Prevention Point is not a homeless shelter. Prevention Point does not have street teams. Prevention Point is not, and maybe shouldn't be, in a position to have to respond to all the unmet needs, and yet they see a lot of those unmet needs. In 2017, we had 1,109 overdose calls to EMS. I frequently told our medics at the time, you may not understand the principles of Prevention Point, but imagine if you had 50% more calls.
Prevention Point is not necessarily a known service in the broader community. In the drug user community, it absolutely is. And I think that's just another indication of how marginalized we've made folks who use substances and the folks that work with them.
The right people have always come along at the right time.
They're a great group of people too. They all have such interesting backgrounds, from nurses to being homeless. They're some of my favorite people in the world.
Just the tremendous joy that I find in my coworkers. Such a wonderful group of people. As staff has changed and grown, it continues to be just one of the most wonderful parts of doing this work.
Prevention Point Pittsburgh is an incredible collection of individuals, volunteers and staff and former staff and founders and board members and participants, and just as a group of people, it's a manifestation of collective hope.
The work that I've done with Prevention Point and with drug users and populations of people that pushed aside, it's made me a really good healthcare provider, and it's made me a much better human being.